Hey there, I'm Dr. Jonathan Towarnicki. I'm a podiatrist, assistant professor in the Department of Orthopedic Surgery with UofL Health. Honestly, medicine was something I knew from the very beginning, probably going all the way back to elementary school that I was interested in. It was just trying to figure out what that specialty was going to be. Growing up, very big into athletics. Soccer was always probably my favorite sport and the one that I was most passionate about. And with that, it goes hand in hand with a bunch of foot and ankle injuries. Into my college career, ended up meeting up with a guy named Dr. Randy Clements, who was a podiatrist that kind of helped steer me in this direction, and it's worked out ever since. We treat everything from an ingrown toenail and just fungal infection of the nails all the way up to more complex deformities such as Charcot foot, where patients have a lot of collapse of the bones of their midfoot, all the way to replacing the ankle joint for arthritic conditions, and everything in between, from tendon pathology, arthritis, very simple things like corns and calluses, and bunions and hammer toes, of course. You don't realize that you're missing something until it's gone, until something begins to hurt, and I think that's really where we come into play. A lot of the patients that we see on a daily basis don't understand just how dynamic of a structure the foot is and how it plays into a much larger role with the entire body, from things like lower back pain, hip pain, knee pain. A lot of that kind of starts with from the ground up, and when there's a problem in the extremity, it certainly can manifest itself more proximal as well, and vice versa. I think one of the neat things that we're able to offer here is the fact that Dr. Ford and myself are fully integrated with the residency program. That gives us the benefit to kind of have eyes and ears everywhere, from patients being seen and triaged very quickly in the emergency room to getting to help and into an office, and further on down the road, whether that be with surgery or therapy, a lot quicker than would be the case if we were just a two-man group on our own. I think that's really grown over the past couple of years now that we're working with 9 of our own residents and 2 fellows, which has gone on a long ways to help us out with what we do on a daily basis. I think the most important thing is really empathy. I want the patient to always be involved in their care with what they're doing, and making sure that they are understanding, each and every step along the way. This is what we're doing, this is why we're doing it, and then letting them have some input along the way as well, because, at the end of the day, we're treating people. This is not a number, it's not a chart in a computer, and something that goes into an electronic medical record. It's an individual in front of you with real problems that need to be addressed. Probably the one thing that I'm really passionate about is Virginia Tech football. I grew up a diehard Virginia Tech football fan. I went to Virginia Tech. Outside of that, I really enjoy golfing. In the wintertime, I love snowboarding, and then certainly in the summer, I'm very big into wakeboarding.